Dr. Henry, a lot of the restrictions that have been put in place are based on the science applied to Delta. And I know things have evolved with Omicron, but one of the outstanding ones has been an impact on events like weddings. The industry is frustrated with this. I'm just wondering what in the science shows you that a hockey game at Rogers Arena with 9,000 people and people cheering and in large cases people without masks on, how is that a safer environment than someone hosting a wedding event?
Yeah, there's always this, how come it's safer to go to Walmart when there's a bunch of people there, and how come it is all about looking at the risk setting, what you're doing in that setting. And I presented that a couple of weeks ago, the whole variety of things that we look at when we were talking about gyms, for example. So we do know that no matter what, it's those group settings when we're coming together, when we are with people that we care about, and weddings are a perfect example. And I just want to clarify, weddings and funeral services are not restricted. It is the celebrations, the parties afterwards. And we know that invariably those are the settings that we are seeing transmission. Not at every single one, clearly, but at many, many, many. And that was what, it's very challenging. And we've all been to wonderful weddings where, yes, you all start off with the right intentions and we're sitting at tables, but you're with people you haven't seen. It's a positive, joyful time. And so at the end of the evening where, it becomes more of a celebration, which is a wonderful thing, but also very risky right now. So yes, there are measures that we have in place that address in a sort of sequential way the highest risk settings, and then we put in mitigation things in lower risk settings. And so we look at a hockey arena. It's a much larger space. There's lots of ventilation. There's space around people with the small numbers of people that are allowed in with the capacity limits, the vaccine card. And yes, we do know that some people, but when you're at a seat with very small number of people around you and a large amount of space, it's much less risky than when you're in a nightclub or an indoor venue where you're closely with people without a mask on. So it is a gradation of risk, and we all know that there's some settings that we are seeing a lot of transmission, and there's some of the very same thing where we don't see any at all. So it is based on risk. That has not changed. The factors that we're seeing have not changed. It's indoor spaces with poorer ventilation, less space, where people are not as likely to wear their mask consistently. Those are places where we see transmission. And as we have more and more transmissible strains of the virus, those become less and less able to or more and more risky, depending on the setting.